1. A nurse is caring for a patient with systemic lupus erythematosus, SLE, who reports severe fatigue and joint pain. Which intervention should the nurse prioritize? 1. Administer pain medication as prescribed. 2. Encourage complete bed rest for 24 hours. 3. Teach energy conservation techniques. Answer. Teach energy conservation techniques. Rationale. Fatigue and joint pain are hallmark symptoms of SLE that impact daily functioning. Teaching energy conservation techniques empowers the patient to manage activities while minimizing exhaustion, promoting long-term self-care. Pain medication addresses only symptoms, and prolonged bed rest may lead to deconditioning, making these less effective for chronic management. 2. A patient with rheumatoid arthritis is admitted with a fever and swollen joints. Which assessment should the nurse perform first? 1. Check the patient's temperature. 2. Inspect the joints for redness and swelling. 3. Review the patient's recent medication history. Answer. Check the patient's temperature. Rationale. Fever in a patient with rheumatoid arthritis may indicate an infection or a disease flare, both of which require urgent evaluation. Checking the temperature first establishes a baseline for prioritizing further assessments or interventions, ensuring patient safety by addressing potential life-threatening conditions promptly. 3. A nurse is delegating tasks for a patient with multiple sclerosis experiencing muscle weakness. Which task should the nurse assign to the unlicensed assistive personnel UAP? 1. Assist with ambulation using a walker. 2. Assess the patient's muscle strength. 3. Teach the patient about physical therapy exercises. Answer. Assist with ambulation using a walker. Rationale. Assisting with ambulation is within the UAP's scope of practice and ensures patient safety by preventing falls. Assessing muscle strength and teaching exercises require clinical judgment and education skills, which are responsibilities of a licensed nurse, making delegation of these tasks inappropriate. 4. A patient with HIV is scheduled for a diagnostic procedure. Which precautions should the nurse implement? 1. Use standard precautions during care. 2. Wear a gown and gloves at all times. 3. Place the patient in airborne isolation. Answer. Use standard precautions during care. Rationale. HIV is transmitted through blood and body fluids, so standard precautions are sufficient to ensure safety during routine care and procedures. Gowns and gloves are not required unless contact with body fluids is anticipated, and airborne isolation is unnecessary as HIV is not transmitted via respiratory droplets. 5. A nurse is prioritizing care for multiple patients. Which patient should the nurse assess first? 1. A patient with SLE reporting a new rash. 2. A patient with myasthenia gravis reporting difficulty swallowing. 3. A patient with fibromyalgia reporting chronic pain. Answer. Assess the patient with myasthenia gravis reporting difficulty swallowing. Rationale. Difficulty swallowing in myasthenia gravis indicates potential airway compromise or aspiration risk, which is life-threatening and requires immediate assessment. A new rash in SLE and chronic pain in fibromyalgia are concerning but less urgent, as they do not pose an immediate threat to airway or breathing. 6. A patient with Sjogren's syndrome reports dry eyes and mouth. Which intervention should the nurse recommend? 1. Use artificial tears and sugar-free lozenges. 2. Increase caffeine intake to stimulate saliva. 3. Apply petroleum jelly to the eyes at night. Answer. Use artificial tears and sugar-free lozenges. Rationale. Sjogren's syndrome causes reduced tear and saliva production, leading to dry eyes and mouth. Artificial tears lubricate the eyes, and sugar-free lozenges stimulate saliva, alleviating symptoms safely. Caffeine may dehydrate, worsening symptoms, and petroleum jelly is unsafe for ocular use due to infection risk. 7. A nurse is planning care for a patient with Guillain-Barré syndrome. Which monitoring should the nurse prioritize? 1. Monitor respiratory rate and depth. 2. Check peripheral pulses hourly. 3. Assess skin integrity daily. Answer. Monitor respiratory rate and depth. Rationale. Guillain-Barré syndrome can cause ascending paralysis, potentially affecting respiratory muscles. Monitoring respiratory rate and depth is critical to detect early signs of respiratory compromise, a life-threatening complication, making it the priority over peripheral pulses or skin integrity. 8. A patient with an immune disorder is prescribed corticosteroids. Which teaching should the nurse provide? 1. Take the medication with food to prevent gastrointestinal upset. 2. Stop the medication if weight gain occurs. 3. Take the medication at night to improve sleep. Answer. Take the medication with food to prevent gastrointestinal upset. Rationale. Corticosteroids can irritate the stomach lining, so taking them with food reduces the risk of gastrointestinal upset or ulcers. Stopping the medication abruptly can cause adrenal insufficiency, and taking it at night may disrupt sleep due to its stimulating effects, making these options unsafe. 9. A nurse is assigning tasks for a patient with systemic sclerosis. Which task should the nurse delegate to the licensed practical nurse, LPN? 1. Administer intravenous immunoglobulin as prescribed. 2. Develop a nutritional plan for the patient. 3. Evaluate the patient's response to therapy. Answer. Administer intravenous immunoglobulin as prescribed. Rationale. Administering intravenous medications, such as immunoglobulin, is within the LPN's scope of practice under the supervision of a registered nurse. Developing a nutritional plan and evaluating therapy responses require advanced assessment and planning skills, which are responsibilities of the registered nurse. 10. A patient with lupus nephritis reports decreased urine output. Which action should the nurse take first? 1. Assess the patient's fluid intake and output. 2. Notify the healthcare provider immediately. 3. Administer a diuretic as prescribed. Answer. Assess the patient's fluid intake and output. Rationale. Decreased urine output in lupus nephritis may indicate worsening renal function, but the nurse must first gather objective data by assessing fluid intake and output to determine the severity and context. This informs whether notification or medication is warranted, ensuring safe and prioritized care. 11. A nurse is caring for a patient with chronic fatigue syndrome. Which intervention should the nurse implement? 1. Plan activities to balance rest and activity. 2. Encourage high-intensity exercise daily. 3. Recommend a high-sugar diet for energy. Answer. Plan activities to balance rest and activity. Rationale. Chronic fatigue syndrome causes persistent exhaustion, and balancing rest with activity prevents overexertion while maintaining function. High-intensity exercise can exacerbate symptoms, and a high-sugar diet may cause energy crashes, making these inappropriate for symptom management. 12. A patient with an immune disorder is at risk for infection. Which instruction should the nurse provide? 1. Wash hands frequently and avoid sick contacts. 2. Avoid all vaccinations to prevent reactions. 3. Consume raw foods to boost immunity. Answer. Wash hands frequently and avoid sick contacts. Rationale. Patients with immune disorders are susceptible to infections, so hand washing and avoiding sick contacts reduce exposure to pathogens. Vaccinations are generally safe and recommended unless contraindicated, and raw foods pose an infection risk due to potential contamination. 13. A nurse is prioritizing tasks for a patient with psoriatic arthritis. Which task should the nurse perform first? 1. Assess the patient's joint mobility. 2. Administer a prescribed anti-inflammatory medication. 3. Teach the patient about skin care. Answer. Assess the patient's joint mobility. Rationale. Assessing joint mobility first provides baseline data to guide medication administration and teaching. Psoriatic arthritis affects joints, and understanding the extent of stiffness or pain ensures interventions are tailored, prioritizing patient safety and effective care planning. 14. A patient with myasthenia gravis is experiencing diplopia. Which action should the nurse take? 1. Apply an eye patch to one eye as needed. 2. Dim the room lights to reduce strain. 3. Encourage reading to strengthen eye muscles. Answer. Apply an eye patch to one eye as needed. Rationale. Diplopia in myasthenia gravis results from weakened eye muscles, causing double vision. An eye patch over one eye eliminates the double image, improving comfort and safety. Dimming lights or reading does not address the neurological cause and may worsen strain or fatigue. 15. A nurse is delegating care for a patient with an immune disorder receiving chemotherapy. Which task should the nurse assign to the UAP? 1. Monitor the patient's temperature every 4 hours. 2. Report any signs of infection immediately. 3. Assess the patient's white blood cell count. Answer. Monitor the patient's temperature every 4 hours. Rationale. Monitoring temperature is a routine task within the UAP scope, helping detect fever as a sign of infection in a chemotherapy patient. Reporting infection signs and assessing lab values require clinical judgment, which are responsibilities of a licensed nurse, not the UAP. 16. A patient with ankylosing spondylitis reports morning stiffness. Which recommendation should the nurse provide? 1. Perform gentle stretching exercises after a warm shower. 2. Remain in bed until stiffness resolves. 3. Apply cold packs to the spine. Answer. Perform gentle stretching exercises after a warm shower. Rationale. Ankylosing spondylitis causes spinal stiffness, and gentle stretching after a warm shower improves mobility and reduces discomfort. Prolonged bed rest worsens stiffness, and cold packs are less effective than heat for relaxing muscles in this condition. 17. A nurse is planning care for a patient with immune thrombocytopenia. Which precaution should the nurse implement? 1. Use soft bristled toothbrushes to prevent bleeding. 2. Encourage contact sports to maintain activity. 3. Administer aspirin for pain relief. Answer. Use soft bristled toothbrushes to prevent bleeding. Rationale. Immune thrombocytopenia causes low platelet counts, increasing bleeding risk. Soft bristled toothbrushes minimize gingival trauma, reducing bleeding. Contact sports and aspirin increase bleeding risk, making them contraindicated in this condition. 18. A patient with Addison's disease is admitted with hypotension. Which action should the nurse prioritize? 1. Administer intravenous fluids as prescribed. 2. Teach the patient about stress management. 3. Encourage a high-sodium diet immediately. Answer. Administer intravenous fluids as prescribed. Rationale. Hypotension in Addison's disease may indicate adrenal crisis, a life-threatening condition requiring urgent fluid resuscitation to stabilize blood pressure. Teaching and dietary changes are important for long-term management, but are not the priority during acute instability. 19. A nurse is assigning responsibilities for a patient with scleroderma. Which task should the nurse assign to the registered nurse RN? 1. Evaluate the patient's skin for ulcers. 2. Apply moisturizer to the patient's skin. 3. Take the patient's vital signs. Answer. Evaluate the patient's skin for ulcers. Rationale. Evaluating skin for ulcers in scleroderma requires clinical judgment to assess for complications like infection or tissue breakdown. A responsibility of the RN. Applying moisturizer and taking vital signs are routine tasks that can be delegated to assistive personnel, not requiring RN expertise. 20. A patient with hypersensitivity reports shortness of breath after allergen exposure. Which action should the nurse take first? 1. Administer epinephrine as prescribed. 2. Teach the patient about allergen avoidance. 3. Place the patient in a supine position. Answer: administer epinephrine as prescribed. Rationale: shortness of breath after allergen exposure suggests anaphylaxis, a medical emergency requiring immediate epinephrine to reverse airway constriction and restore breathing. Teaching and positioning are secondary, as they do not address the acute, life-threatening reaction promptly. 21. A nurse is caring for a patient with sarcoidosis reporting shortness of breath. Which assessment should the nurse prioritize? 1. Auscultate lung sounds. 2. Check oxygen saturation levels. 3. Review the patient's recent chest X-ray. Answer: auscultate lung sounds. Rationale: shortness of breath in sarcoidosis may indicate pulmonary involvement, such as granulomas affecting lung tissue. Auscultating lung sounds first provides immediate data on airway patency and lung function, guiding further interventions like oxygen administration, ensuring timely management of a potentially life-threatening symptom. 22. A patient with Hashimoto's thyroiditis reports weight gain and fatigue. Which intervention should the nurse implement? 1. Monitor the patient's thyroid hormone levels. 2. Encourage a low-calorie diet immediately. 3. Recommend vigorous exercise to boost energy. Answer: monitor the patient's thyroid hormone levels. Rationale: Hashimoto's thyroiditis causes hypothyroidism, leading to weight gain and fatigue due to inadequate thyroid hormone production. Monitoring thyroid hormone levels ensures appropriate medication adjustments, addressing the underlying cause. Diet and exercise are secondary until hormone levels are stabilized, as they may exacerbate fatigue if implemented prematurely. 23. A nurse is delegating tasks for a patient with celiac disease experiencing diarrhea. Which task should the nurse assign to the unlicensed assistive personnel UAP? 1. Provide perineal care after bowel movements. 2. Assess the patient's hydration status. 3. Educate the patient on a gluten-free diet. Answer: provide perineal care after bowel movements. Rationale: providing perineal care is a routine task within the UAP scope, promoting patient comfort and preventing skin breakdown. Assessing hydration and educating on diet require clinical judgment and teaching skills, which are responsibilities of the licensed nurse, making these inappropriate for delegation. 24. A patient with Goodpasture syndrome is admitted with hemoptysis. Which action should the nurse take first? 1. Prepare the patient for oxygen therapy. 2. Notify the healthcare provider immediately. 3. Collect a sputum sample for culture. Answer: prepare the patient for oxygen therapy. Rationale: hemoptysis in Goodpasture syndrome indicates potential pulmonary hemorrhage, a life-threatening complication affecting oxygenation. Preparing for oxygen therapy addresses immediate respiratory needs, stabilizing the patient while further interventions are coordinated. Notification and sputum collection follow, but are not the first priority. 25. A nurse is prioritizing care for multiple patients with immune disorders. Which patient should the nurse assess first? 1. A patient with Sjogren's syndrome reporting dry eyes. 2. A patient with systemic sclerosis reporting chest pain. 3. A patient with lupus reporting joint stiffness. Answer: assess the patient with systemic sclerosis reporting chest pain. Rationale: chest pain and systemic sclerosis may indicate cardiopulmonary complications, such as pulmonary hypertension or pericarditis, which are potentially life-threatening. Dry eyes and joint stiffness, while uncomfortable, are less urgent, as they do not pose immediate risks to vital organ function. 26. A patient with primary immunodeficiency is prescribed prophylactic antibiotics. Which teaching should the nurse provide? 1. Take the medication exactly as prescribed. 2. Stop the medication if feeling better. 3. Double the dose if a dose is missed. Answer: take the medication exactly as prescribed. Rationale: prophylactic antibiotics in primary immunodeficiency prevent infections, and adherence to the prescribed regimen is critical to maintain therapeutic levels. Stopping early or doubling doses disrupts efficacy and increases resistance or toxicity risks, compromising patient safety. 27. A nurse is planning care for a patient with dermatomyositis. Which monitoring should the nurse prioritize? 1. Assess muscle strength regularly. 2. Check skin temperature hourly. 3. Monitor dietary intake daily. Answer: assess muscle strength regularly. Rationale: dermatomyositis causes progressive muscle weakness, which can impair mobility and respiratory function. Regular muscle strength assessment detects deterioration early, enabling timely interventions to prevent complications like falls or respiratory failure, making it the priority over skin temperature or diet monitoring. 28. A patient with chronic granulomatous disease reports a fever. Which action should the nurse take first? 1. Obtain blood cultures as prescribed. 2. Administer acetaminophen immediately. 3. Encourage increased fluid intake. Answer: obtain blood cultures as prescribed. Rationale: fever in chronic granulomatous disease suggests a possible serious infection due to impaired immune response. Obtaining blood cultures first identifies the causative organism, guiding appropriate treatment. Administering acetaminophen or increasing fluids may mask symptoms or delay diagnosis, compromising timely care. 29. A nurse is assigning tasks for a patient with mixed connective tissue disease. Which task should the nurse delegate to the licensed practical nurse (LPN)? 1. Administer subcutaneous methotrexate as prescribed. 2. Develop a plan to manage Raynaud's phenomenon. 3. Evaluate the patient's response to immunosuppressive therapy. Answer: administer subcutaneous methotrexate as prescribed. Rationale: administering subcutaneous medications is within the LPN's scope under supervision. Developing a management plan and evaluating therapy responses require advanced assessment and planning, which are responsibilities of the registered nurse, making these tasks inappropriate for delegation. 30. A patient with polymyalgia rheumatica reports new onset headache. Which action should the nurse prioritize? 1. Notify the healthcare provider immediately. 2. Administer a prescribed analgesic. 3. Encourage rest in a dark room. Answer: notify the healthcare provider immediately. Rationale: a new headache in polymyalgia rheumatica may indicate giant cell arteritis, a serious complication risking vision loss. Immediate notification ensures prompt diagnosis and treatment, prioritizing patient safety. Analgesics or rest may delay critical intervention, as they do not address the underlying cause. 31. A nurse is caring for a patient with acquired immunodeficiency syndrome, AIDS, and oral thrush. Which intervention should the nurse implement? 1. Administer antifungal mouthwash as prescribed. 2. Encourage spicy foods to stimulate appetite. 3. Apply petroleum jelly to the oral mucosa. Answer: administer antifungal mouthwash as prescribed. Rationale: oral thrush in AIDS is caused by candida overgrowth, requiring antifungal treatment to resolve infection and improve comfort. Spicy foods may irritate the mucosa, and petroleum jelly is ineffective and unsafe for oral use, making these inappropriate interventions. 32. A patient with Behçet's disease reports painful oral ulcers. Which recommendation should the nurse provide? 1. Use a corticosteroid mouth rinse as prescribed. 2. Brush teeth vigorously to clean ulcers. 3. Consume acidic foods to promote healing. Answer: use a corticosteroid mouth rinse as prescribed. Rationale: Behçet's disease causes recurrent oral ulcers, and corticosteroid rinses reduce inflammation and pain, promoting healing. Vigorous brushing or acidic foods can exacerbate irritation and delay recovery, making these contraindicated for managing ulcer symptoms. 33. A nurse is delegating care for a patient with antiphospholipid syndrome. Which task should the nurse assign to the UAP? 1. Monitor the patient's leg for swelling. 2. Assess the patient's clotting times. 3. Teach the patient about anticoagulant therapy. Answer. Monitor the patient's leg for swelling. Rationale. Monitoring for leg swelling is a routine observation within the UAP scope, helping detect signs of thrombosis. Assessing clotting times and teaching about therapy require clinical judgment and education skills, which are responsibilities of the licensed nurse, not the UAP. 34. A patient with eosinophilic granulomatosis with polyangiitis reports numbness in the feet. Which action should the nurse take first? 1. Assess the patient's neurological status. 2. Apply warm compresses to the feet. 3. Encourage ambulation to improve circulation. Answer. Assess the patient's neurological status. Rationale. Numbness in eosinophilic granulomatosis with polyangiitis may indicate peripheral neuropathy or vasculitis affecting nerves, requiring immediate assessment to determine severity and guide treatment. Warm compresses or ambulation may be unsafe without understanding the cause. Prioritizing thorough evaluation first. 35. A nurse is prioritizing tasks for a patient with immune thrombocytopenic purpura, ITP. Which task should the nurse perform first? 1. Check for signs of bruising or petechiae. 2. Administer a platelet transfusion as prescribed. 3. Teach the patient about activity restrictions. Answer. Check for signs of bruising or petechiae. Rationale. IDP causes low platelet counts, increasing bleeding risk. Checking for bruising or petechiae first assesses for active bleeding, guiding the urgency of interventions like transfusions. Teaching is important, but secondary to ensuring no immediate hemorrhage exists. 36. A patient with relapsing remitting multiple sclerosis reports blurred vision. Which action should the nurse take? 1. Refer the patient for an ophthalmology consult. 2. Encourage eye exercises to improve focus. 3. Dim the room lights to reduce glare. Answer. Refer the patient for an ophthalmology consult. Rationale. Blurred vision in multiple sclerosis may indicate optic neuritis, a serious exacerbation requiring specialist evaluation. Eye exercises are ineffective for neurological causes, and dimming lights does not address the underlying inflammation, making referral the priority for timely treatment. 37. A nurse is planning care for a patient with hypersensitivity type I reaction history. Which precaution should the nurse implement? 1. Ensure an epinephrine autoinjector is accessible. 2. Place the patient in a negative pressure room. 3. Avoid all latex products in the room. Answer. Ensure an epinephrine autoinjector is accessible. Rationale. Type 1 hypersensitivity reactions like anaphylaxis require immediate epinephrine to reverse life-threatening symptoms. A negative pressure room is for airborne infections, not allergies, and latex avoidance is specific to latex allergies, not all type I reactions, making epinephrine access the priority. 38. A patient with autoimmune hepatitis reports nausea and jaundice. Which intervention should the nurse prioritize? 1. Monitor liver function tests as prescribed. 2. Encourage a high-fat diet to improve nutrition. 3. Administer an antiemetic immediately. Answer. Monitor liver function tests as prescribed. Rationale. Nausea and jaundice in autoimmune hepatitis indicate worsening liver function, requiring monitoring of liver function tests to assess disease progression and guide treatment. High-fat diets strain the liver, and antiemetics treat symptoms without addressing the underlying cause, making monitoring the priority. 39. A nurse is assigning responsibilities for a patient with IgA nephropathy. Which task should the nurse assign to the registered nurse RN? 1. Evaluate the patient's urine for hematuria. 2. Assist with daily hygiene activities. 3. Measure the patient's blood pressure. Answer. Evaluate the patient's urine for hematuria. Rationale. Evaluating urine for hematuria in IgA nephropathy requires clinical judgment to assess disease activity. A responsibility of the RN. Hygiene assistance and blood pressure measurement are routine tasks delegable to assistive personnel, not requiring RN expertise. 40. A patient with sarcoidosis is experiencing hypercalcemia. Which instruction should the nurse provide? 1. Increase fluid intake to promote calcium excretion. 2. Consume dairy products to balance electrolytes. 3. Limit physical activity to reduce bone turnover. Answer. Increase fluid intake to promote calcium excretion. Rationale. Hypercalcemia and sarcoidosis results from excessive vitamin D activation, and increased fluid intake promotes renal calcium excretion, reducing serum levels. Dairy products worsen hypercalcemia, and limiting activity is unnecessary, as it does not address calcium metabolism directly. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.